Dr. Ruivo. I
Good morning.
ask, so I'm going to stop share and give the floor now to Dr. Ruivo, and kindly ask all the participants to turn their video off, except the moderators of the Innovation Village that can be here. Please turn the video off so we can have Dr. Ruivo on the session, and panelists, please turn their video, stay on the information. Dr. Ruivo, thank you so much for being here. I know that you have a busy schedule these days as the president of our National Authority of Medicines and Technology, Healthcare Technology. It's really a pleasure to having us. Out at the forum, Innovation Village, all yours.
Thank you very much. Good morning. I would like, first of all, to thank Paulo Nunes Abreu for the invitation to participate in this initiative, which I acknowledge as a very relevant and very timely as well to discuss this kind of issues, health data, particularly at this time. I also would like to greet our the colleagues that are in the different parallel sessions that will occur after this introduction, and I hope we will have interesting shares, interesting discussions. I mean, we've been so busy with COVID that is almost difficult to think in other issues, but certainly we have seen also from the COVID perspective the importance of data, of sharing information. So I think this the concept that I mean, I also would like to participate for the entire meeting, but probably I will not be able to do so. That this concept of using the potential of the online tools to disseminate participation and knowledge is very important. As you say, virtual doesn't mean distant. So this is really relevant to look at these aspects. I think that there have been discussions on central topics like generating health information, data harmonization, results of data analysis, sources. For my side, more in the field I'm working more directly, it's very important now the discussion on all the issues of big data and data analytics. Here in this Innovation Village, we will touch on aspects that are very relevant for the patients, for the health system. So the telehealth services, where when we say contingency or permanence, and I mean, I will look for the discussion, but certainly this is very important for the service that we want to provide to patients, and probably will move on towards more permanence. In the news today, there is even a newspaper which says that there will be more telemedical appointments, so which is of course very important at this moment. We will have also the discussions on clinical and scientific decisions, the management of resources, and of course all the more the technological aspects that are being stemming from the current situation. So all the issues related to cybersecurity and how the IT systems can respond to the new ways of working and of developing our activities. I would like to take the opportunity, and I think I still have a little bit of time to share also from the perspective of INFARMED, of the regulatory authority, since of course we had to firstly to adapt to this situation. And of course, when we had to be all working at home with just a few people like myself to continue being at the office, of course, we had to look into all the security aspects and the cybersecurity challenges, and this is very, very important. We had to train by remote ways our staff because we didn't have the time to train them all. But also, I think now we should also look into the potential and the challenges that are stemming from this experience. And here there are issues like how to do inspections without going to the premises of the different companies or entities that we are supposed to inspect. Issues like the availability of medicines and other medical equipment, how we could establish better systems of sharing information within the entire system. So stemming from the companies, so to identify what is actually the availability and what is the demand. So this is something that we had to look at, and certainly this will be something that will be developed. Of course, also to look into trust issues, ethical issues in terms of trusting the information that we are identifying, that we are collecting. These are just a few examples of aspects. I would like to conclude to say that I think from this recent experience, I'm optimistic in terms of what I will expect to see from now on. So I believe that this will drive to positive developments, both at national level, but also at European level. I also would like to touch, and I think I heard something already on this aspect from a few moments that I heard in discussions, that also we have seen that EU was not completely prepared to respond as a whole, as a union. So I think this will be a discussion that we'll have, and certainly all the possibility of sharing data and information will be a key aspect on this. We were just this morning before coming to this forum having a teleconference with all the European agencies, the EMEA, the Commission, and the other agencies, and we were discussing issues like once we will have vaccines developed, once we will have certain medicines developed, how will they be available? Because one thing is to develop them, one thing is to get them authorized, but then they have to be produced in quantities that will be sufficient to the needs of the health system. And how do we ensure that the supply capacity is then linked to the needs? So this is something that we need to discuss, and we need to see how this kind of information will be shared in a wider context. We are already having a concrete example with remdesivir, which is this drug that you all heard, because there's been lots of news about it. And there is an early access program which allows the access to certain quantities for urgent situations. But even for this is necessary to see, for all the cases that will arise, will we have we will have sufficient drugs. So these are kind of issues, and we see developments at the European level which I think are positive in this respect, and certainly these are issues also that I think will be connected to the discussions we'll have this morning. And I thank you for also the opportunity to be here to share my notes with you. And again, I wish a very fruitful discussion in this innovation village. Thank you again, Paulo, for the opportunity, and my greetings to all of you.
It's really a pleasure to have you here. Thank you. Just that we have a Facebook audience online with 1,000 people, and I know that you will allow me one quick question. When will the vaccines be? Can we really expect everybody to be vaccinated, in your expert opinion?
I'm sorry to not be able to give you an answer, Paulo. There's a high number of products to be developed, and both vaccines, it's dozens of them, but they are still in early stages. So the same applies to the treatment. So although we have this particular case that I mentioned, which is public, so I could mention it, but there are many others that are already being also prepared to submit. But it's too early to say. I hope that we will be able to have one or more soon, and also that the virus will not what is the English word, will not be too clever to cheat on us in relation to this development, because we are also concerned about this.
Thank you so much, Dr. Ivo, and I apologize for this journalistic clue.
Thank you very much.
So we have to prepare for the uncertainty. That is the key message. Is that, I think.
Yes.
So congratulations for the extremely great work you're doing with Santos, making Portugal very proud, as Portuguese, very proud of being a good example in Europe of how we are containing this pandemic. Thank you so much for joining.
Thank you very much. Thank you very much.